Hello, my name is Dr. Xiong. I'm an internal medicine physician from Dallas, Texas. Welcome back to another episode of Say It in English Doc. Today we're talking about a term called AIDS. AIDS stands for Acquired Immunodeficiency Syndrome. AIDS is caused by a virus called HIV. A lot of patients will ask me, what's the difference between HIV and AIDS? So HIV, all it tells you is a viral infection. The virus comes into your body, it can cause different kind of damages, but this virus particularly, it damages our immune system. Particularly a very specific type of lymphocyte we call CD4 cells. So the CD4 cells is very important for our immune system. Without it, our immune system is basically very, very weak. So when someone has an HIV infection, sometimes the virus destroys so many CD4 cells, the CD4 count drops below 200. When that happens, we call this type of patient who have AIDS, or acquired immunodeficiency syndrome. Most of the time, the patient will not even know they have AIDS until they have what we call AIDS-defining illness. So there are a few examples of them. There are a lot of AIDS-defining illness. I'll give a few very common examples. For example, oral thrush. Normally we don't have oral thrush because our immune system is able to fight off the fungus in our oral cavity. But when you have AIDS, some people, they just have oral thrush without any reason. Sometimes they have skin lesion, particularly what we call Kaposi sarcoma, which is a type of skin lesion which is caused by a different type of virus, which is normally not a problem for normal population, but when you have AIDS, you can have that. Another example is you can have a specific type of pneumonia we call PCP, or pneumocystitis pneumonitis. So PCP is, I think right now we call it fungus. In the history, there are different ways to call this. Sometimes we call it protozoa, but now we think it is a fungus. But anyway, it is a small microbiome that can cause infection to someone who is immunosuppressed. It doesn't usually cause problem for a normal person. So when you have those things, you have to be worried, that person is immunosuppressed. And in this kind of conditions, when the CD4 count drops below 200, we think the patient qualified to be called as AIDS patient. If you have any questions regarding AIDS, please comment below.